Cancer Society is that women start mammography at age 40. And all they said in their recommendations was that at age 40, the patient should discuss it with their doctor and discuss the risks and benefits. Because there's some controversy as to what the risks and benefits are between 40 and 50. So this came out, and these recommendations were really not very different from what the U.S. Task Force had recommended 5 years prior. But it came out when Obama was trying to reform health care. And you saw the press. Everybody was accusing the government of now rationing health care, that the only reason they're going from 40 to 50 was to cut costs. It became a hot political issue, and from that moment on, the Obama administration could not discuss anything that was vaguely suggestive of rationing health care.
It is an ethical question because in societies such as ours versus Great Britain, politicians or society as a whole have to decide, if you're 96 years old, should you have a pacemaker? If you're 80 years old, should we get a kidney transplant? And those are very difficult ethical questions, which we can't answer in this show either. It takes too long.
Well, no, we can't answer those, but that is what the society is going to have to come to grips with. Providing dialysis for elderly patients raises the cost of healthcare. So in England, in 1990, when I practiced there, 1990, that's not long ago, once you were over 65, you did not get dialysis. Now, if Medicare stopped doing dialysis, I don't actually know the numbers, but that would make a significant impact in the overall cost of healthcare. But this society is not prepared to do that.
I visit ICU patients, and many times the ICU patients are elderly, are in their 80s. And there are also countries where we have a form of one single payer system where they have definitions of who goes to the ICU for what level of care. For example, if they have a tumor discovered at age 80 and they have a complicated surgery, let's say a Whipple, which you do, what happens here?
Well, in this country, the opportunity to provide aggressive health care to our seniors is something that the society has chosen to pay for. And because this society, one of the major tenets of this society is to have choice, that's how we've gotten to this situation, is that everybody feels that they should always have choice, regardless of cost. And so that goes to the fact that the way that the insurance structure has evolved, including Medicare, there's been a dissociation of services and cost for the patient. So let's talk about our seniors. They see their doctor. There's a discussion about whether or not they should get another MRI scan for their back pain, for example. Okay? The actual cost of that study, which can be several $1,000s, some of these very sophisticated imaging studies are very expensive. That cost is not really seen by the patient who's receiving that service. And if there was some association of the cost of what they're receiving, then the patient would be forced to consider the relative return on their investment. But right now, because insurance covers everything and Medicare covers everything, you have that dissociation, and then you get this escalation of everybody wants to know more, not realizing that by doing so, we're making the government broke.
Now, there is a trend among the private insurers for people who are less than age 65, who are not Medicare participants, that they're increasing the co-pays, increasing the patient's knowledge of what this is going to cost. And there are also medical spending accounts because they're trying to create a culture where people learn that what you're asking for is
exactly.
expensive.
And that's why the internet's going to help everybody because everybody's going to get educated. Obviously, there are issues with the internet, and you're still going to need to have a physician to interpret what's available out there. But the more educated the patients are about what's available, and absolutely the more educated they are about the cost, they will help make those decisions. And I'm sure when you ask an 80-year-old, do you want me to spend $3,000 on X, Y, or Z scan? I've had patients, oh, I don't want that scan. That's too expensive. I don't want, even though they're not paying for it. And so I think that you have to reestablish a partnership between the physician and the patient to actually discuss the finances of what they're doing. And one of the problems is that we as physicians in this country are not trained to deal with the business of medicine. And that has really contributed to the situation we're in, is that we've stepped back and we've let the business community take over the business of medicine. You know, when I interact with an insurance company now, they don't even refer to me as doctor. I'm a provider. I mean, how insulting is that? Okay? I don't even respond to that, actually. It's really offensive. And the insurance companies have taken over everything. And the American way is make a profit, right? So the insurance companies take all the money. If you look at what's been happening, patients are paying more and more for insurance. Physicians are getting paid less and less by Medicare and by insurance companies. And the CEOs and the administrators of insurance companies are getting richer and richer. But that's the American way. And so society is going to have to decide whether we allow the private sector to regulate the delivery of health care as a privilege, i.e. for those who have money, or is there a certain degree of health care that is a right, just like having clean air is a right, or having food or shelter, some would say, is a right, because the state provides a lot for that for those who can't. So if there's a minimum amount of health care provided by the state, I think that would be the first step to fixing the current problem, because then you can take care of the population as a whole, but we already know that they can't provide everything because that's unaffordable.
We also have the issue of malpractice in America. And malpractice attorneys are a big group in America versus China, versus England, versus France. They're not as strong.
Correct. The business community and the legal community have a much better funded lobby, and they control the rules. You know, attorneys outspend physicians 5 to 1 in what goes to the political action committees. They have lots of lobbyists, just like the insurance companies probably outspend us 100 to 1 with their lobbies. So they control the rules, and so they can optimize their profit from the system. Now, that is American society. Attorneys are entitled to run their